All right, once again, guys, here we go. Chapter 9 covers rehabilitation and restorative care. When we talk about rehabilitation and restorative, we're really talking about therapy, physical therapy, occupational therapy. Là, on a parlé de réhabilitation restaurative, on a parlé de thérapie. Okay? This is managed by licensed professionals. Okay? So a therapist is a licensed professional. Okay? So rehabilitation therapy is for people, okay, for patients, I would say, for a patient who lost function or ability, okay, due to an illness or accident. Okay? C'est pour patient qui perdu fonction ou qui perdu habilité, soit à cause d'une maladie ou bien un accident. Okay? So, if your patient stays in bed for a long time, they may not be able to walk. They need therapy. There's something we call the law of use. La loi de l'usage. If you don't use something, you lose it. Si gon bagay ou possédé, que ou pas utilisé, qui ça va passer ou? Va perdu. If you were a very good piano player and you stop playing for 1 year or 2 years, you're no longer a very good piano player. So tu quand jouer piano très bien, pas jouer, right? If you stay in bed for long, you lose the use of your leg. Ou être dans cabane pendant trop longtemps, 2 semaines, 3 semaines après opération, ou perdre fonction. You lose the function after 2 to 3 years of staying in bed. Okay? So if the patient is paralyzed, losing an arm, leg, eyes, patient with stroke, one arm weak, one arm paralyzed. So physical or occupational therapy, right? It's done to regain function or to adapt to the new changes. Sometimes we can't fix the problem. The person has to just adapt. Des fois, on ne peut pas fixer le problème, non? Thérapie, c'est pour aider les patients à adapter à ce problème, non? Okay? Restorative care, this is the type of therapy that they do when rehabilitation is complete. So rehabilitation help the patient to walk. Restorative help the patient to continue to walk without having to go back to being paralyzed. Réhabilitation, c'est un type de thérapie qui a fait patient qu'à marcher encore. Restaurative là, c'est pour qu'il toujours continuer à marcher sans qu'il ne pas regresser pour le retourner back dans paralysé. Okay? Repeat again. OK. Réhabilitation, c'est physicothérapie. Ah oui? Patient, t'es sous chaise roulante, il va te marcher. Nous faisons réhabilitation pour lui. Il vient marcher. Quand il y a pendant qu'il marcher, il a besoin de deuxième type de thérapie pour ne pas retourner à zéro. OK? All right. So is it clear for everybody? Is it clear? Very good. So the goal is to maintain the progress accomplished by rehabilitation. If your patient is receiving restorative care, You, the nursing assistant, need to be patient because that resident is going to be very slow. They need you to take time with them. You need to be positive. Okay? Et pas pour décourager moun nan. You shouldn't be the one to discourage that person. Be supportive. A lot of people are not where they are in life because they are connected to negative people in their lives. Gen moun ki pa rive nan nivou yo ta dwe rive nan viya parce que yo est connecté trop longtemps à moun ki négatif. Some people are more comfortable saying, you can't do it. You're too old, you're too young, you're too poor. Gen moun ki profil professionnel nan décourager l'autre moun. Ou trop grand moun, ou trop jeune, ou trop pauvre, ou gen trop responsabilité. They will give you all kinds of reasons for you to not move forward. Il y a toute qualité de raison pour pas avancer. You cannot be that kind of person with the resident. On the contrary, be positive. Start being positive with yourself. Commencez positif à tête pa. Start believing you can. Then it will be easier to talk to other people about positivity. Okay? Commencez positif à tête ou. Start believing in yourself and help. Then you can help the resident believe in themselves. Okay? If you are depressed, you will contaminate the patient with your depression. If you are negative, you will pass it along to your resident or to your family. Can you imagine? Est-ce que tu as imaginé? You turn your kids into a negative person? Hein? Si vous faites si moun yo vin négatif, même j'avou, ou fini, oui? Yes, ka prend la relève. If you turn your kids into a negative person like you are, what does your future look like? Imagine you are so negative, you turn your spouse negative. Imagine ou tellement négatif, ou même madame ou négatif. How grave. A negative person will say, it's okay, it's only a heart attack, stay home. It's gonna be okay. They're not gonna take good care of you in the hospital anyway. You know what's gonna happen to you? You're dead. All right. So negative people are like weeds in the garden. They will destroy your produce. Moun ki négatif la yon tan kou son zeb nan jardin. La krasé, la manje tout sa wap chèche donè.
Le man finis ki nan tout sa met. Moun zan ek di moun san ba bezwen poske mge ki ma bezyen.
There you go. So I know I have a lot of negative people in my life. I stopped talking to most of them. People that tell you don't do it, you're already HHA. That's what they just told us. You're already an HHA. You're too old. You can't study. It's too late. If you're negative, that's my answer. Well, negative, all right. So you need to be positive to your resident, okay? All right. Encourage your resident to perform activities and exercise that they prescribe. Patient is gonna think they can't do it. You have to be the one that says, you know what, I think you can do it. Give it a try. You know what, rest, take some rest. Rest for just a second, and let's try it again. Okay? 10 patients faut t'y poser, et on repartit encore. Observe and report. The job of an excellent nursing assistant. Responsabilité en nursing assistant qui est excellent. Always observe the resident to report to the nurse. One day, when you become the nurse, you're going to appreciate the fact that you have a CNA who's observing and reporting to you about the resident. L'envie de nurse, ou pral gen plus respect pour un CNA qui fait job la bien, qui observe, qui report, qui pay attention. You will have more respect for that person. Why? Because that's a professional. Il y a deux façons de pratiquer un métier. Professionnellement ou médiocrement. You can practice a profession with professionalism or mediocrity. Your choice. C'est un choix.
Souvent, on va continuer ça.
You understand what he said? Ask him. Ask him. No. She needs to understand. Go ahead. Ask him. Ballon réponse. Give her an answer. No, I can't speak. Papa, be quiet. Be quiet. Okay? You have no hair. Be quiet. Why am I getting shaved in that? Papa, I want you to make that effort. Come on. She said she don't understand. Say it in English. Try it, Papa. She's not Haitian, Papa. It's a fight trying to get you. Listen. Go ahead.
When you see it, sometimes underness, usually white or verbal.
And you understand that, right? So he wants to know if the report should be in writing or verbal report. Both. As long as you listen, if you don't try it here, you're not gonna be successful at the job interview. Et pas l'arriver dans job interview à pour aller essayer, bon men là.
I think so. I speak slow.
Speak slow, speak fast. I don't care. Just speak.
Try.
Right? Try. Let me tell you something. I have been teaching this class since 2015. Ma pensée classe a depuis 2015. 2015, 16, 17, 18, 2020, 21, 22. Sometimes my class is full of Cape Verdeans. This year they can't speak English. The next year they show up, they're speaking it. Année ça yo pa parler anglais, année prochaine yo paraît yo si anglais sou. I see it all the time. Why? They have no choice. Speak English or die hungry. Right? Parle anglais ou bien mourir glagou. Right? You have the job, you need the job, you got to speak the English. Me no speaking English, but me need the job. Okay? So me give you patient the patient the caca in the bathroom. The caca look very bad on the floor. Caca is everywhere, caca. But I clean for you. I clean very good. Very clean, you. Very smell good. Ça vous fait un temps. Pas de honte dans là, non? So comment on fait? Anglais à ma pour devine solide. Oh, ouais,
We're not going to the street.
I would. When I go to the street, I see the cat for me. What's this? They're like, we go out. Even a judge, remember should have to with all that. Là, vous savez quand même. You will live, you will. Ça pouvait pas me combattre. Non, ça.
Et puis, par exemple, de tout, est-ce que vous faites? C'est mon domicile.
Anyway, so observe and report change in ability, change in attitude, motivation. Patient loses motivation. Okay? General health, change in health, changement en santé. Okay? Mental change in mental status. Patient seems depressed. Tell the nurse. Okay? So, during rehabilitation, we need to promote independence. Encourage the resident to be more independent. Encourage activity. Encourage movement. If your patient is going to therapy, ask the nurse for pain medication for that patient. Because therapy can be very painful. Okay? Patient pral nan thérapie, a fon ti parane sa mande médicament pour douleur. Okay? All right. So, one exercise is called ambulation. Ambulation means walking. So when we say that this patient is ambulatory, ambulatory, that means this patient can walk. Okay? All right. Now, patient can ambulate independently. Patient can ambulate with assistance. Okay? Ambulate with assistance means this patient needs someone to hold their hands. They need help with walking. State exam. State exam skill is assisting a resident to ambulate using a gait belt. Okay? So so this is something that they could ask you to perform on the state exam. Okay? Edouard Brutus, ambulation using a gait belt. Okay? After tonight, all we do is skills. So while I do skills, you continue to review the chapters. Pendant ma fè skill yo nan klas la, wap kontinye revize chapit yo tou. Okay? Because the goal is what? Passing the state exam. Okay? I already told you. July, I want that CNA certificate. Right? You're very smart. You can do it. Huh? That's it. By July, you have that CNA certificate. By September, back to college, back to school, back to college, engineer, docteur, avocat. Right? Doctor, nurses, lawyers, rich woman, right? There you go. Earlier today, a friend of mine, a coworker, was driving by. He saw me. He stopped and said hello to me. On ancien travailleur que dès qu'on a travaillé ensemble, les campé machine maybe pour saluer moi. And when I knew him, I was an RN with my bachelor's. He was an LPN. Today, he's a nurse practitioner. Oh, I am so proud. I am so proud. Go from an LPN, RN, BSN, nurse practitioner. Oh, no, I should say RN, BSN, nurse practitioner. He passed me, and I'm happy with that. Why? Because we need more professionals. Nous besoin plus professionnels. I mean, of course, I make more money than him, but that's not important right now. But hey, the higher you go, the better. Plus vous montez plus haut, c'est plus les plus bon. Okay? Okay. Gait belt. A belt that goes over your waist. Okay? Over your clothing. Vous mettez sous tête et atlas, sous radeau. Make it tight around your waist. Okay? Is that right? Right? We'll find out soon.
No R.
No R. Oh yeah, no R. There you go. There you go. Thank you. Okay, so you put it around the waist of the patient. When you're ambulating a resident with using a gait belt, walk slightly behind and on the side, behind to the side. Okay? Pas derrière, mais un peu sous côté. Okay? While holding on to the gait belt. Ou pas derrière, you're behind, but to the side, you're holding on the gait belt. You're standing on the weak side. Okay? Ou campé sous bord qui faible. Okay? Resident may ambulate using a cane. Patient cap marcher en utilisant un cane. Only the nurse can adjust the height of that cane to match the height of the patient. Okay? C'est nurse seulement qui t'a dû ajuster hauteur cane pour matcher hauteur patient. So for example, if this is a cane, right? The nurse can adjust it. Okay? They can adjust it. Okay? All right? So if it's too short, tell the nurse. Don't try to fix it. Next, the strong hand of the resident will hold on to the cane. Next, put 6 inches in front. Good leg, weak leg. 6 inches, the strong hand. Strong leg, weak leg. 6 inches, strong leg, weak leg. Strong, weak. All right. So while the resident is ambulating, you're standing on the weak side to support the resident. A quad cane is a cane that has 4 rubber-tipped feet. Okay? So quad cane, page 238. Okay, page 238. All right. Now, resident on rehabilitation may use assistive devices. Okay? Resident on rehabilitation can utiliser ça nous appelle assistive device. Sometimes we would call it adaptive. Sometimes we would call it orthotic devices. Assistive, adaptive, orthotic devices. Okay? Devices that they create to help the resident become more independent and adapt to their situation. So, c'est des appareils que vous créez pour aider les patients à devenir plus indépendants et puis pour l'adapter. Example, walker, cane, wheelchair. Okay? What else? Reachers. Reachers, something to help them reach for something. Okay? Un matériel utilisé pour aider les prendre l'autre bagaille qui doit. Okay? Special spoons. Spoon with special handles. Gen seye de cuillère qui gen des manches spéciales to adapt to the hand. Okay, pour adapter à ben. Same thing with cones, forks, and cups.
CP cups.
CP cup or nosy cup. They would create a cup kind of like this. When the patient drink, there's room for their nose. You can see it on page I believe so, 241. All right? Okay, moving on. All right. Another type of patient that would need rehabilitation or therapy would be a patient who had an amputation. L'autre type de patient qui a besoin de réhabilitation avec thérapie, c'est une qui était fait en amputation. Amputation is when the patient loses a limb. Patient perdu your membre. Arm, finger, foot, legs, okay? But they lost it either by ways of surgery or accident. Yo perdu membre par moyen de opération chirurgicale ou bien par accident. Okay? So the loss of that member, of that arm or leg, we call it an amputation. Perte de membre, amputation. So when a patient suffers an amputation, okay, they may experience what we call phantom sensation. You can experience ça relate sensation de fantôme. This is when they feel sensation on the body part that is now absent. C'est lorsque vous avez une sensation dans membre ça qui vient absent kounya. So, no leg, patient says, my toe is hurting. Or I can feel my toe. Okay? Yo coupe pied, patient met col like la on parce que tête orteil dans pied ça. Yo coupe a fait mal. Il senti douleur avec. It's not something that they imagine, but it is real pain. Because psychically, spiritually, everything in the body is connected into one. Okay? Tout corps a connecté tant qu'on yon seul. Au point où même membre qui pas là, yon senti présence, yon senti, yon souffri absence et douleur là. So CNA needs to report that pain so we can medicate that patient. These patients may be using what we call a prosthesis. Patient sa yo capable utiliser un bagay yo rele prosthesis. Prosthesis is a device that they create to replace the body part that is missing, that is deformed because of accident, injury, or illness or birth defect. So, prosthesis là, c'est un matériel que vous créez pour remplacer partie qui pas là encore, ou bien qui déformée, soit à cause d'accident, injury, maladie, ou bien défection qui fait depuis la naissance. So, for example, they would create an artificial leg, artificial arm, artificial hand, artificial eye, etc. Nursing assistant must follow the guideline on amputation and prosthetic care. For suivre guideline, comment pour bailler soin avec un patient qui fait amputation, OK? Et comment pour prendre soin prosthesis là. There are some guidelines on how to care for the prosthesis. These things are very expensive. Okay? They are very expensive and they can break. Okay? The health insurance may not want to pay for it a second time. Assurance santé a gè pa vle payer pour l'encore. M'pa conseiller au monde pour aimer l'argent, pour chercher l'argent. I would not advise anybody to fall in love with money or look for money. But hurry up and make a lot of money. Because some things health insurance may not want to pay for. You got to be able to write a check for $20,000. OK? M'babdou al chercher faire l'argent, non? Mais, faire vite, faire pile comme serré. Parce que y a des bagages qui ont besoin d'assurance santé, pas vle payer. Faut qu'à écrire un chèque $20,000 pour dire, mais ça, qu'un bel pour sauver la vie. Ou bien petite, ou bien madame, moi. Being poor sucks. So bagay ki dégoûte dans la bof. You know? But if you know that right now, hurry up. Don't stay CNA. Move up quick. Parit nan niveau CNA, non? Li pa bon pou monte bureau. Okay. So, be gentle with the prosthesis. Get some training on how to care for it and how to clean it. Okay? Ask the nurse to show you how to clean it, how to take care of it. If it's broken, report it to the nurse. Don't try to fix it. Your patient had an amputation. Observe standard precaution. Wash your hands, wear gloves, prevent infection at the amputation site. Prévenir infection dans zone côté amputation est faite là, côté au coupé here. Sometimes the person that sends the patient to the grave is the CNA. Des fois, moun ki pou y passer dans cercle à dans cimetière c'est CNA. If you're careless, you will cause cross-contamination. Sou pa care, ou ka cause contamination sot nan chambre sa, nan chambre sa. You're not supposed to wear gloves from this room and then go to that room with the same gloves. You're supposed to wash your hands. No gloves in the hallway. Wash your hands before you put on gloves, after you remove gloves. Before you give patient care, after you finish giving patient care, wash your hands. Infection you cause can kill people. How do you think so many people died during COVID? Comment pensez un pile passé de nation mourir avec COVID? CNAs and nurses come and say, hey, listen, I have COVID. You want some here? By the way, here, you want COVID? You want COVID? The patients don't go anywhere. People bring it to them. Right? Infection, urinary tract infection, infection urinaire. Clean up this patient. Not very good hand washing. Go to this patient. Clean this patient. Infection. Okay? Next is range of motion. Range of motion are exercises that move the joint, okay, through its full arc of motion. C'est un mouvement qui fait que jointure la virer tout autant qu'elle a viré dans toute capacité qu'elle a viré. Okay? Range of motion, it's important. Range of motion is important to prevent atrophy. Muscles become shorter. To prevent contraction, muscles become stiff, joint becomes stiff, can't move it. To improve strength, pour améliorer force patient, we need to do range of motion. 3 types of range of motion exercises. Page 243, there's active range of motion. Active range of motion, patient does it by themselves. Patient fait pour compte lui. AROM, active range of motion. PROM, passive range of motion. Patient not able to do the exercise, so the CNA does it all for the patient. Passive range of motion, non patient pas qu'à faire, c'est où fait le pour lui. Active assisted range of motion. AAROM, patient is too weak to perform the exercise by themselves, so they need some help. Patient trop faible, li pa ka faire exercice la pour compte li, li besoin aider. Okay? So, exercises are abduction. Okay? So you need to know the meaning, right? So abduction, putting the arm or limb away from the body. Adduction, bringing it closer to the midline. Flexion, closing the joint. Extension, opening the joint. Dorsiflexion, with the hand or the foot. Rotation, rotation, pronation, supination. Opposition with the fingers. There's plantar flexion, eversion, inversion. Ça yo pas la donne mais c'est moi qui ajouter pour. So plantar flexion is not in your book, but I added it for you. Why? Because it could come up. Another book has it. Plantar flexion, eversion, inversion. Radial flexion, ulnar flexion. So don't worry, I will print this out for you, but still write those 5. Plantar flexion. Inversion, eversion. Radial flexion. Ulnar flexion. All right. If you go to the website, right? You go to this website here, C14, right? Watch this video on passive range of motion. Okay? It's 11 minutes long. After you watch this video, you can go on YouTube and watch my video on range of motion. So this video on range of motion, I focus on what the state will test you on. Dans vidéo maintenant, moi focus exactement sur ça l'état pour tester ou là-dedans. So, pour tout gagner pour ça là. So if you don't pass that scale, it's not my fault. All you gotta do is spend the time. C'est un petit temps seulement pour passer là-dedans. But when si mte kon professeur pare mwen dem de l'école, that's before. If I had a teacher like me when I was back in school, I'd be better. All right. Okay, so guidelines, how to perform range of motion. You need to remember this information. Okay? You need to remember this information. Let me call it state exam info. Support the during range of motion. Pendant examen, what do I say range of motion, no? You need to support the limb with both arms. Supporter pour être là avec deux mains. Support the leg with both arms. Okay? Number 2, be gentle. So the movement should be gentle and fluid. Not hard, but soft. Perform the exercise at least 3 times. Fais exercice là au moins 3 fois. Flexion, extension. Flexion, extension. Flexion, extension. Now for the state exam, do it at least 5 times just in case the examiner says they didn't see the first one or the second one. Pendant examen l'État, fais-le n'importe 5 fois. Parce que si le professeur dit le pas well, ça veut dire pas de faire. La raison du plus fort est toujours la meilleure. So on the state exam, do it at least 5 times, just in case the examiner didn't see the first one. Ask the patient if he or she has pain during the exercise. And before the exercise, ask the patient. Okay? Range of motion exercises. You start from the top and you move down to the bottom. Ou commencer depuis la tête pour descendre dans pied. All right? Now, when you're doing the range of motion, do not go beyond the point of resistance. Pas aller au-delà du point de résistance. C'est-à-dire, if the patient can only go this high up, okay, patient can only go this high up with flexion, don't force it to make it close. Okay? You're doing flexion, extension, flexion, extension, flexion, extension. But this patient can only go this much. Don't force it to make it go higher. You can break the joint because maybe he had surgery. Pas forcer pour aller au-delà du point de résistance faciale. Okay? All right. Bowel and bladder training, retraining. This is if your patient is incontinent. Ça, c'est si patient est incontinent. Okay? Incontinent means patient cannot hold the urine or the bowel movement. Patient pas quelqu'un de pipi ou bien quelqu'un de pouvoir. So retraining basically is building a schedule to make the patient get used to the schedule so they go according to a schedule. Okay? Retraining, c'est là, on fait bâtir un schedule, un horaire. De temps en temps, ou bien les patients aller à la selle et puis quand patient vient suivre horaire. Okay? So, follow standard precaution and follow a schedule for bathroom use. That's it for chapter 9.